picture this. It's 2 in the morning, and your kid wakes you up with a cough. But it's not just any cough. It's that harsh.
Oh, yeah,
Like almost barking
I
sound.
know exactly.
That can totally freak you out as a parent.
Yeah.
That my friend is the sound of croup.
Yeah.
And tonight, we're going deep
Okay.
to help you understand and even manage this common childhood ailment. We've got the latest medical guidance, some surprising historical remedies.
Interesting.
And even a glimpse into the cutting-edge research that might just change how we think about croup in the future.
It really is fascinating how something that sounds so scary can often be managed at home, you know?
Right.
But knowing the facts,
Yeah.
that's always the first step to
Definitely.
feeling confident and prepared.
Absolutely. So let's break this down.
Yeah.
What exactly is happening in your little one's body when that croupy cough strikes?
Well, essentially, croup is inflammation of the upper airway,
Okay.
specifically the larynx and the trachea.
Got it.
And because young children have naturally narrower airways, they're much more prone to that telltale bark and struggle to breathe.
Makes sense. So the inflammation is making their already tiny airways even tinier.
Exactly.
But what about that distinct barking sound? What's going on there?
It's actually physics at work. The swelling creates a much narrower passage for air to flow through, causing that turbulence and that harsh barking cough. You might also hear stridor.
Stridor.
Which is a noisy breathing, especially when your child inhales.
So when they're breathing in. Okay, so far so good. Now, I always thought croup was caused solely by the parainfluenza virus.
Right.
But our research suggests it's not quite that simple anymore.
Yeah, you're right. The landscape for croup is definitely changing.
Interesting.
While parainfluenza is still the most frequent offender,
Studies
are showing that other common cold viruses like rhinoviruses and enteroviruses are increasingly playing a role.
So it's not just one virus we need to be aware of.
Right.
But here's a question that's always baffled me. Why does croup seem to get worse at night? Is it something about the darkness or...
Actually, there's a biological reason for this. Think about how our energy naturally dips in the evening.
Yeah.
Cortisol, our body's natural anti-inflammatory,
Okay.
works in a similar way. It's like our immune system's night shift is less equipped to handle that inflammation, allowing the croup symptoms to intensify.
Interesting.
Just as you're trying to get some shut-eye.
Wow, that's such a clear way to understand it. Okay, so you think your child might have croup. What's the next step? Is it an automatic trip to the doctor? Or are there times when you can take a wait-and-see approach?
Well, that's where careful observation comes in.
Okay.
Doctors use scoring systems to assess how severe the croup is.
Okay.
They consider factors like the severity of the stridor, how much the child's chest is retracting as they breathe air entry, and even their skin color.
Okay.
These all help to paint a picture of how much they're struggling.
So it's not always a mad dash to the ER? But how would I know if it's serious enough to warrant a trip to the doctor? What are the red flags?
Exactly. Mild cases often improve with home care.
Okay.
But here's the crucial part. You must be able to distinguish croup from other conditions that might seem similar, but are far more serious.
Got it.
For example, a high fever drooling and what doctors call a toxic appearance, which means the child looks very ill, pale, lethargic, maybe even slightly bluish around the lips.
Oh, wow.
Those are signs of something more serious, like epiglottitis or bacterial tracheitis.
Right.
Those require immediate medical attention.
Those are definitely red flags I'll be watching out for. But let's say it's mild croup. What's the go-to treatment these days? I remember my mom talking about those steam tents. Did those actually do anything?
The steam tent, a classic example of how medical thinking evolves.
Right.
While it was once a go-to remedy studies,
Okay.
including a comprehensive analysis called a Cochrane Review,
Okay.
have found steam inhalation to be ineffective for croup.
Really? I'm surprised. Why do you think that myth persisted for so long?
Perhaps it was the intuitive appeal of moist air soothing a cough.
Yeah.
But research has shown that it doesn't significantly improve symptoms.
Well, there goes that old wives' tale. So if steam isn't the answer, what does work?
The modern cornerstone of croup treatment is corticosteroids.
Okay.
And the superstar of this group is dexamethasone.
Dexamethasone. So tell me, how does this wonder drug work? It's magic.
A single dose of dexamethasone can dramatically reduce inflammation, making it easier for your child to breathe and often preventing the need for further intervention.
Wow.
It's truly a game changer in croup care.
That's reassuring to know, but what if the croup is more severe?
Right.
And dexamethasone isn't enough?
Yeah.
What other options are out there?
For those more intense cases, nebulized epinephrine can be used.
Okay.
It works quickly to open up the airways and provide relief, but the effects are temporary.
That makes sense.
Hmm.
It's like a quick fix to get them breathing comfortably again. But are we just talking about medications here? Are there other things parents can do to help their child through a bout of croup? I mean, beyond just giving them medicine.
Absolutely. One often overlooked factor is anxiety.
Oh,
A frightened child tends to breathe faster and shallower,
right.
which can actually worsen the symptoms.
Yeah.
Creating a calm and reassuring environment can actually help improve their breathing.
It's so important. Just having mom or dad there can make a world of difference.
Exactly.
Sometimes a human touch is the best medicine.
It really can be.
Now, here's another crucial point. Antibiotics are not typically used for croup.
Right.
Since croup is usually caused by a virus, antibiotics wouldn't help.
Exactly.
And overusing them only contributes to antibiotic resistance,
Right.
which is a huge global health concern.
Huge.
That's a good reminder. We definitely don't want to contribute to that problem.
No.
Okay, so we've got the basics of croup down, but what about the future of croup care? What exciting advancements are on the horizon?
Well, there are some fascinating developments.
Oh.
One is the rise of telemedicine,
Telemedicine.
which is especially valuable during events like pandemics.
Right.
It allows doctors to assess and manage croup remotely,
Oh, wow.
minimizing exposure risks and unnecessary hospital visits.
So instead of dragging a sick child to the doctor in the middle of the night, you can potentially get expert advice from the comfort of your own home.
Exactly.
That's pretty incredible.
It is.
What else is in the pipeline?
Another exciting area is point-of-care ultrasound, or POCUS.
POCUS.
This non-invasive tool can quickly and accurately assess airway obstruction,
Okay.
leading to faster and more precise diagnoses.
So imagine a world where a doctor can get a clear picture of what's happening in your child's airway in a matter of minutes right there in the exam room.
Yeah.
That could really change the game.
Precisely. And with that kind of information, they can make much more informed decisions about treatment.
This is also promising. But let's bring it back to the present.
Okay.
For those listening who are dealing with croup right now, what are some practical, actionable tips they can use at home?
Okay.
What do they really need to know?
First and foremost, stay calm. Your demeanor can affect your child's anxiety levels, which can impact their breathing. Keep your child upright, as this can make breathing easier, and monitor their symptoms closely.
Great tips. So it's all about staying calm, keeping them comfortable, and knowing when to seek help.
Yeah.
But what are some specific symptoms parents should be watching for?
Keep an eye out for signs of difficulty breathing, such as blue lips or a rapid heart rate.
Okay.
Never hesitate to contact your healthcare provider
Right.
if you're concerned.
Those are fantastic tips and really highlight the importance of being informed and proactive.
Exactly. And remember, you are not alone.
Right.
Croup is incredibly common, and most cases resolve with minimal intervention. The key is having the right knowledge and taking a calm, informed approach.
Well said. It seems we've reached the end of part 1 of our croup deep dive.
Yeah.
Join us next time as we debunk some common croup myths and explore what the future holds for managing this common childhood ailment.
It should be interesting.
We'll be back with even more insights and answers to your questions. See you soon for part 2.
See you then.
Welcome back to our deep dive into the world of croup.
It's good to be back.
Before we jump into the fascinating realm of cutting-edge research and future treatments,
Right.
let's take a moment to address some of the myths and misconceptions
Oh, I like this.
that still swirl around this common childhood ailment.
Yeah.
I mean, who hasn't heard a grandma swear by a good old-fashioned humidifier?
You're absolutely right. Even in this age of instant information, it's amazing how many old wives' tales persist.
Right.
And the humidifier is a perfect example.
Okay.
While it seems intuitive that moist air would soothe a cough,
Yeah.
research has actually shown that humidifiers, even those trusty steam vaporizers,
Yeah.
don't significantly improve croup symptoms.
Wow, that's surprising. I guess sometimes those home remedies aren't as effective as we think.
What other croup myths should we debunk?
Another big one is the idea that antibiotics are the answer to any cough.
Right.
As we discussed earlier, croup is typically caused by a virus, not bacteria.
Right.
And antibiotics only work against bacteria.
Yep.
Giving a child antibiotics for a viral infection like croup
Yeah.
won't help and can actually contribute to antibiotic resistance,
Right.
which is a huge global health concern.
That's a great point. We really need to be mindful of how we use antibiotics and trust our healthcare providers to guide us on DABR when they're truly necessary. But speaking of healthcare, One thing that's really caught my eye is the potential of telemedicine, especially when it comes to managing croup. I mean, think about it. It could be a game changer for families in rural areas or those who have difficulty accessing in-person care. Absolutely. Telemedicine is transforming so many aspects of healthcare, and croup care is no exception. Imagine this. You're at home, your child wakes up with that barking cough, and instead of bundling them up for a late night trip to the doctor, you can connect with a healthcare provider through a video call. They can assess your child's symptoms remotely, often using simple techniques you can do at home, and guide you on the best course of action.
That's incredible. So instead of a stressful trip to the ER, you can get expert advice from the comfort of your own home.
Right.
It seems like telemedicine is making quality healthcare more accessible than ever. But telemedicine isn't the only technological advancement that has me excited. We also have point-of-care ultrasound, or POCUS, on the horizon. Can you break that down for us? How might it impact croup diagnosis?
Imagine a portable ultrasound device that can be used right there in the exam room to visualize the child's airway in real time.
Okay.
That's POCUS. It's non-invasive, quick, and can provide valuable information about the degree of airway narrowing, helping clinicians make faster and more accurate decisions about treatment.
So instead of relying solely on listening to the cough or observing the child's breathing, doctors could actually see what's happening inside the airway.
Exactly.
That's amazing.
It's like having a window into the body,
Wow.
allowing for a much more precise and targeted approach to care.
Wow, it's incredible how technology is transforming medicine.
But beyond these technological advancements, are there any other promising areas of research that could change how we approach croup in the future?
There are a few things on the horizon that I find incredibly exciting. One area researchers are exploring is the development of new antiviral medications.
Oh, interesting.
These medications could specifically target the viruses that cause croup,
Okay.
potentially shortening the duration of the illness and reducing the severity of symptoms.
So instead of just managing the symptoms, we might actually be able to fight the virus head on.
Precisely.
Yeah.
And another very promising avenue of research is the development of vaccines against parainfluenza viruses, the most common culprits behind croup,
Right.
if we can effectively prevent these infections in the first place.
We can significantly reduce the number of croup cases, especially those that require medical intervention.
Now, that would be a game changer. A vaccine for croup could truly transform how we approach this childhood illness. But while we eagerly await these breakthroughs, are there any steps parents can take now to help prevent their children from getting croup in the first place?
The good news is that many of the same hygiene practices that protect against other respiratory viruses also apply to croup. Things like frequent hand washing, covering coughs and sneezes, and avoiding contact with sick individuals can significantly reduce the risk of transmission. And of course, if and when a vaccine for parainfluenza becomes available, that will be a major step forward in prevention.
It seems like those common sense hygiene measures really go a long way. But even with the best preventative measures, sometimes those viruses sneak through. So it's reassuring to know that we have effective treatments available and that even more innovative solutions are on the horizon. Speaking of the future, one thing that's been on my mind is the fact that new viruses are being linked to croup, especially in recent years. How do you think this might change our approach to prevention and treatment going forward?
That's a fantastic question, and it's one that researchers are actively investigating. As we learn more about these emerging viral culprits, we'll need to adapt our strategies. This might involve developing new diagnostic tools that can quickly identify the specific virus causing the croup, which would allow for more targeted treatment.
So instead of a one-size-fits-all approach to croup, we might be moving towards a more personalized approach based on the specific virus involved.
Exactly. And we might also see the development of antiviral medications that are effective against a broader range of viruses. This would give us more options for treating croup regardless of the underlying cause.
It's incredible to think about how our understanding of croup is constantly evolving and how these new discoveries are shaping the future of care. It's a reminder that we always need to stay curious, stay informed, and be open to new possibilities.
Well said. Croup, like many areas of medicine, is a dynamic field, and staying up to date on the latest research and advancements is essential for providing the best possible care for our children.
And that wraps up part 2 of our Croup Deep Dive. We've tackled some common myths, explored the latest technological advancements, and even ventured into the future of croup care.
It's been quite a journey.
Join us for part 3, where we'll answer some listener questions and wrap up with key takeaways for parents and caregivers.
Sounds good.
Until then, stay curious, stay informed, and we'll see you on the next deep dive.
See you then.
Welcome back to the final part of our Croup Deep Dive.
All right.
We've covered a lot of ground, From understanding what's happening in your child's airway
Uh-huh.
to exploring cutting-edge treatments and even peeking into the future of croup care.
It's exciting stuff.
But before we wrap up, let's distill some key takeaways and answer some of your excellent questions.
Okay, sounds good.
You know, one of the most reassuring things for parents to remember
Yeah.
is that croup,
Uh-huh.
while it can sound terrifying,
Oh, yeah.
is usually a mild illness that can be effectively managed at home.
Exactly.
The key is being prepared.
Right.
Familiarize yourself with the signs and symptoms.
Yeah.
Understand when it's time to seek medical attention. And have a few strategies in your back pocket for managing those symptoms at home.
Right.
Absolutely. We've talked about the power of a calm and reassuring environment,
Yes.
keeping the child upright to help them breathe easier,
Right.
and closely monitoring those symptoms. Sometimes the simplest things can make the biggest difference.
They really can. And while those old-school remedies like steam inhalation might sound good in theory,
Yeah.
they haven't been scientifically proven to be effective, sticking with evidence-based treatments,
Oh,
like those corticosteroids we discussed.
Oh.
And always following your healthcare provider's guidance is essential.
It's all about making informed decisions, right? Relying on solid evidence, not just what grandma used to do. Now let's get to some of those listener questions.
Yeah.
Here's one that I think a lot of parents can relate to. My child seems to get croup all the time. Is there anything I can do to prevent it?
That's a question we hear a lot. Unfortunately, there's no magic shield to completely prevent croup. You know, it spreads through those pesky respiratory droplets, just like the common cold. But those good hygiene practices we talked about, frequent hand washing, covering coughs and sneezes, and avoiding close contact with sick people can really help reduce the risk.
Good old-fashioned hygiene.
Yeah.
Never goes out of style. Okay, here's another question from a listener. My doctor mentioned point-of-care ultrasound for diagnosing croup. Is this something that's widely available? Should I be asking for it?
Point-of-care ultrasound, or POCUS, is an incredibly promising tool for croup diagnosis because it gives us that real-time look at what's happening in the child's airway.
Right.
However, it's not yet a standard practice in every healthcare setting.
Okay. If you're curious about POCUS and whether it's available in your area, it's absolutely worth discussing with your healthcare provider.
It's exciting to see this technology becoming more accessible. Okay, last question. This one is about those emerging viruses we touched on earlier. The listener asks, I'm worried about the new viruses being linked to croup. Should I be taking extra precautions?
I understand the concern about these new players in the croup game. The key is to stay informed about recommendations from reliable sources like public health authorities.
Yeah.
Those good hygiene practices we keep coming back to, staying up to date on vaccinations and consulting your healthcare provider when needed, are your best lines of defense.
Those are all great tips and really underscore the importance of being proactive and informed.
Exactly. And remember, you are not alone in this. Croup is incredibly common, and with the right knowledge and approach, most cases resolve without any major complications.
Well said. It looks like we've reached the end of our croup deep dive. I hope this journey has been informative and, most importantly, empowering for you.
We encourage you to continue exploring this topic.
Yeah.
Knowledge really is power, especially when it comes to the health of our little ones.
It really is.
And if you have more questions or just want to share your croup experiences, don't hesitate to reach out to your healthcare provider. They are your best resource for personalized advice.
They are the experts.
Absolutely. And remember, you are the expert on your child. Trust your instincts and never hesitate to advocate for their well-being.
I love that.
Beautifully said. And with that, we'll wrap up this deep dive. Until next time, stay curious, stay informed, and take care of those little ones.
See you later.